Can we have Amlan and Jatin turn on their videos as well?
Yeah, yes, ma'am. I'm turning on the video.
Yeah.
Sorry, Sudhanshu and Amlan. Sorry.
Yes, ma'am.
Jatin was there all along. Okay.
We are also live, so we can
Alright.
start
We can
maybe
start.
in the next
Okay.
minute.
Okay. Should we start?
Yes, ma'am.
All right. Okay. Good evening, everyone, and welcome to one and all. Today we have an interesting topic for a panel discussion, and I'm sure many would be interested to know what does it mean to be an Indian optometrist or a glorified optician. So now that NCHP Act has been passed, the significance of comprehensive eye examination has been elevated. But how many of us actually do it? And how do we do it without any fancy equipment? Or is it actually necessary? How can we build our practice? So to get all these answers, OCI and Asira has come up with this panel discussion with the young and dynamic panelists. Let me start the session by introducing all of them. We have Mr. Amlan Chakma from Tripura. Amlan did his Bachelor of Optometry from Assam Downtown University in 2020. He opened his private practice named Tanuj Optometry Vision Center in Tripura and provide personalized vision care. Welcome, Amlan.
Yes, thank you, ma'am. Thank you for introduction.
Another panelist is Mr. Jatin Kinger from Pune. He did his Bachelor of Optometry from Bharati Vidyapit School of Optometry. He further pursued a fellowship in contact lenses at Sankaraya Eye Hospital. He is founder and owner of Visio Care in Pune and offers a comprehensive suite of services, including specialty contact lenses. Welcome, Jatin.
Thank you for the introduction.
We also have Mr. Sudhanshu Dhanotia with us. Sudhanshu did his B Optom and M Optom from Bharati Vidyapit. He is owner of City Eye Care Opticals and Optometry Clinic in Indore and provides best-in-class eye care in Indore. Welcome, Sudhanshu.
Thank you.
And our fourth panelist is Mr. Monil Champaneria. Monil completed his B Optom from Bharati Vidyapit. He further did fellowship in contact lenses from Sankara Nethralaya. He is owner of Blinkers Eye Clinic and Optical in Surat and offers all primary eye care services, including specialty contact lenses. Welcome, Monil.
Thank you so much, ma'am.
Yeah, looks like a BVP reunion. All of them are from BVP.
Yes.
Okay, I would like to invite our moderator for the session today, Ms. Isha Dave from Asira. She completed an undergraduate degree in optometry as well as master's in clinical optometry at City University, London. She was a locum optometrist in the UK before starting an independent practice in Mumbai in 2012.
Sorry, Harshada, I'm going to interrupt you. I don't
Yeah,
think they
sure.
need to hear my CV.
Oh, no, it is necessary, of course.
So thank you so much, Harshita. Thank you so much for having us all here today. And we're really happy to be here.
Yeah, great. Okay, and one more thing, she's a co-founder at Asira Practice Management Software. So welcome, Isha. We'll just quickly, before starting all the discussion, we'll just quickly take one poll so that we know how many of them are students and how many of them are practitioners. One second, let me just launch the, yes. Okay. Is it visible?
Yeah,
Yes.
yes,
Yeah,
ma'am.
okay, great. We'll just give 30 seconds to this and then we'll start the discussion.
Someone's missing.
Okay. Yeah, so most of them are practitioners.
Monil's disappeared. There we go.
Okay, we'll end the poll now. Thank you so much. Okay, without wasting more time now, I'll hand over the session to Isha. Isha, over to you now. Yeah.
Thank you. Thank you, Harshada. Thank you so much for the introduction. Big thank you to OCI for co-hosting this event with us, and a huge thank you to our 4 panelists. It was really important for us to get some young, fresh eyes in optometry, because I feel like we've been seeing the same people, including myself, over and over and over again everywhere. So I really wanted to have some young optometrists, all of them under 30, all of them entrepreneurs, all of them running their own businesses successfully. And so I think you guys are the perfect group to be here. And I'm very, very happy to have you guys here. So thank you. Okay, great. So let's kick off. So what I'm going to do is I would like to just fire some questions at you guys, and we will make this into a more interactive discussion. So let's start with one by one. If you could all share. So I'm going to go through one by one, all of you, and if you could all share your journey to optometry. So what inspired you to pursue this profession? So if we can start with Sudhanshu, 1 minute. Tell
Okay.
me in 1 minute.
So from the beginning, as my father is also an optometrist and he owns his own store, and when I saw him that he is doing such a noble job, like providing an eye care and making a difference over there. So from that point, I realized that I wanted to go into the same field. And when I passed my 12th, I directly appeared for the exam in Bharati Vidyapeeth and got selected. Initially, when I was in the college, I saw that the people around me, the students around me, they were those who were not selected in the ophthalmology, and they were kind of what I can say demotivated that वो नहीं मिला तो ये कर लेते. But including me and one other 2 people, they were interested in the optometry. From there, I think my journey was started, like how to enter in the field, how to talk to the people who are already in the field. Then I joined many of the conferences along with many of the pioneers in the industry itself. And then after the bachelor degree was completed, I asked my father that master's degree भी करना है. So he was like कि चश्मे के लिए इसकी जरूरत है क्या? Then जब हमारी बातचीत हुई इस बारे में, then he also realized that something extra was needed to make a difference in the society. And
Great.
after that, I pursued my master's, and then here I am doing all kind of practices.
Wonderful. That's fantastic. Thank you so much for sharing your story. Amlan, how about you? What inspired you to become an optometrist? 1 minute, please.
Mute, I guess.
Amlan, are you on mute?
Yeah.
Okay, Amlan, we'll come back to you. Jatin, how about you?
So, Sudhanshu and I were sort of batchmates. Both of us joined BBP. So actually, we've always been a business family. We were into books earlier, and the minute I cleared my 10th, my father was like, it's time to consider something else maybe. We don't know how long books are going to be used, because there was this iPad and all of the whole digitalization thing happening. So that's when we already had a family member who was already an optometrist. So we considered, okay, like this sounds like a good option. There's good profit margins in the frames, of course. So that was the thing that we had in mind when I got into this. But as I completed my bachelor's, I realized that there's something more that can be done. So that is why I started my own private practice as well. My father still has an optical, but that is more on the basis of a pure optical thing. But I do a comprehensive optometry thing in this
Great.
place.
Fantastic. Amlan, are you good to go?
Yeah, yes, ma'am. Actually, I didn't know about optometry before taking this course. So when my father introduced this course, means regarding optometry to me. So because of my father, I took admission. Then after taking admission, I knew about optometry. So it is for me it's new during my uh, curriculum or during my college.
Okay. Okay, so again, this was another story where you were influenced a lot by your background and your family and your father. Yes?
Yes.
Yes, yes.
Okay, great. Monil, 1 minute, please.
So I
Same
guess I do
question.
have a same story, I would say. Like even though my family, my cousins are into optical and optometry business. So that's what I have been, dreaming since my 12th grade. And one point which I noticed that the practice in Maharashtra side or in the South India side, it's far more superior as compared to the west side of the India. So that gave me a little bit of kick to bring that type of quality service to my own hometown by providing comprehensive clinic service.
Okay, fantastic. So thank you so much. So my next question is, I'm going to ask this question. We're going to go to Jatin for this because you had, in fact, all of you can take a stab at it. We'll start with Jatin. So what do you see? Because you mentioned that, okay, I want to, I wanted to do, when I started doing it to sell spectacles, but then as I did it more, I realized there's some more to this. So what do you see as the key differences as in an optometrist and an optician in terms of training and responsibilities and scope of practice?
Yeah, am I audible?
Yes.
Yeah. So actually, till almost my third year, I was thinking, ki, it's fine, like spectacles, like if that is all that I'm doing, I'm fine with it. But it was my internship that made me think, ki, nahi, like there are contact lenses that we can do. There's orthoptics, there's oculoplasty. There's so much more to be done. And it's fine if you're not doing all of those things every day in and out, but doing it once a month also is a very good thing. Like it is still an upgrade to then what has been going on for so many months or years in my father's case. So doing at least once a month also was sort of like a satisfaction because I could have done the spectacle selling business without a bachelor's as well. So I invested 4 years of my life. What more can I get out of it is what I was thinking when I thought, nay, I want a different place. I want to do something different.
Okay, so Jatin, you mentioned a lot about specialities. So you mentioned about orthoptics, you mentioned about, but even an optometrist who is not doing, so Monal, I'm going to bring this question across to you. Even an optometrist who is not doing specialities. So if you're not doing specialities, does that make you a glorified optician?
I would say to some extent it is correct because primarily we are meant to do refractions. Like the one who's not practicing specialty service are more into clinical works and comprehensive refraction stuff. And
What do you mean by comprehensive refraction stuff? So the question that I posed to you guys is you're saying that just because somebody is not fitting scleral lenses or doing vision therapy, does that mean that they are a glorified optician? Or could they be doing something as part of their as part of their routine eye examinations that would differentiate them from an optician?
Yes, ma'am. Actually, the one who has completed 4 years graduation in optometry, they are not glorified opticians. They are particularly optometrist only. Because if you talk about refraction, there are 10 steps which we do as an optometrist, starting from duochrome to JCC, each and every point. And if you take some other optician person who just does the auto ref and just keep the lenses in the royal frame and just get the 6x6 vision if it comes. So they don't do refraction at max level. So optometrists, even though they are not specialized in some field, let's say scleral or anything else, but they are doing their refraction job. Primary diagnosis, like maybe increase in diabetes can cause some myopic shift. So this person can detect and they can request them to go for the systemic evaluation.
Okay. So Amlan, I'm going to ask you a question now. That basically right now, all Jatin and Monal have told me is that optometrists are better at refraction. Is that the only job of an optometrist, just to do a refraction?
I would like to tell that as per the National Commission for Allied and Healthcare Act 2021, Section 15, Subsection 1, Subsection 2. Yeah, can you hear me? Am I audible?
Little bit. It's a little
Hello.
It breaks up a little bit, but continue.
Yeah. Is it clear right now?
Yes, it is clear right now.
As per the National Commission for Allied and Healthcare Act 2021, Section 15, Subsection 1, Subsection 2, and subsection means subsection A, subsection B, subsection C. So optometrist can hold office, and optometrist can do comprehensive eye examination. So no other than optometrist can practice. So it is illegal for an optician or for other person to do refraction.
So, but that
So
was
as
not my question, Amlan. My question was that we all know we can do refractions. Like, if you're an optometrist, the minimum you should be able to do is a refraction, the absolute minimum. But but is that where it ends? Either you do refraction and or you do only refraction, or you do refraction and specialities. Is there nothing in between?
yeah, it's there. So it's
Sudhanshu.
only
Yes, actually, I want to continue what Monil was saying. So, right from the history taking, right from the point where patient enters, first of all, if he's entering for an eye exam, he's a patient. That is where we start making a difference. अगर कस्टमर की तरह उसको हम ट्रीट करते हैं, then it's like कि फ्री आई टेस्ट करा, चश्मा दिया, बाहर करा. But if we are taking them as a patient, so that is the point where it makes difference. जहाँ वो 4 साल की डिग्री हमारी काम आती है.
Exactly.
So right from the entering, when you are seeing the person, like if we say bumping into the objects, right from there, you can start doing your investigations कि आपको history taking में क्या क्या questions पूछना है. सिर्फ रिफ्रैक्शन से हम ऑप्टोमेट्रिस्ट नहीं बनते. सो राइट्स फ्रॉम द हिस्ट्री टेकिंग टू द फाइनल कंसल्टेशन वेयर यू हेल्प योर पेशेंट to select the spectacles. So that's the part where we are doing our dispensing optics. So optometry starts from the history taking to the dispensing optics, and in between there is a like huge profiles. Like agar patient ko diabetes hai, then the line of management changes. So we are not providing a treatment, we are providing a management. So
Amlan, thank you for that, Sudhanshu. So Amlan, I'm going to come back to you. So Sudhanshu said history taking, refraction, dispensing. Is there anything else that you think optometrists should be doing other than these 3 things and like scleral lenses?
we can do comprehensive eye examination,
Sorry?
phonometry and fundus examination. Phonometry and fundus examination.
Fundus examination.
Hello, is
Okay,
it
what
clear?
else?
Yeah. Yeah, that for that we can do that thing only for comprehensive one.
Yeah. So fundus examination. So do the 3 of you ever examine the fundus?
Yes.
not on
What we are qualified to. So as per the
Yes,
NCAHP, we are actually allowed to put diagnostic drops in the patient's eyes. We are allowed to dilate, and we are allowed to do fundus examinations. And all of you, some of you have master's degrees. So all of you have been well trained in ocular disease. Is that right?
Yes.
So how many of you, so we know Amlan is doing it, obviously, because he mentioned that he's doing it. So how many of you would do that? So, for example, you're saying you have a patient. So Monil, Sudhanshu mentioned he has a diabetic patient. What is stopping you from putting the drops in and dilating the patient, having a good look at the fundus to look for diabetic retinopathy?
I think the main thing that is stopping us from doing that on a regular basis is that faith of the regular population in us is not as high as it is in an ophthalmologist. Just because we are owning a optical store in front and having a clinic in back, people think this guy is just an optician until and unless we start telling about us. वहाँ उसके बाद then they allow us, then we do it. But what the other eye care professionals are doing is that they are creating this kind of dilemma in patient's mind that he's just an optician. That doesn't matter if he's having an optometry degree. It is just an optician person.
Right.
So that is the point where we stop ourselves, because that is not only point where we are losing the faith of the customer. That time he is a customer. That time he is not a patient.
Okay, so this comes to my next question regarding professional identity and perception, right? So you actually answered the question. So what do you think, so Monil, what do you think that you could do as an optometrist to give yourself a professional identity where it would make, I mean, is that something that you want? Is that something that you strive for your opticians to see you as a clinical practitioner and not, sorry, your patients to see you as a clinical practitioner and not just a chashma wala?
So one of the most important factor would be your environment, your surroundings, in which setup you are, practicing.
Mm-hmm.
So for me, I have invested more in the backs of my store as compared to the front side by
Okay.
getting the instruments, by getting the trial sets, by creating a positive environment. So that creates an first feeling of professionalism. Then clothes, I would say, wearing a formal attire would create some more trust in front of the patient, because the normal chashma wala, as we say, doesn't wear professional clothes in and out every day. They come in casuals also sometimes.
Right.
2 points. And I would say third is your vocabulary, how confidently you are speaking in front of your patient, explaining the diagnosis or taking the history or type of question you ask while, doing the eye test. So these are the minor points which creates a differentiate between you and the other person.
I don't think they are minor points at all, Monir. I think they are major
Major
points.
points, yeah.
I think they're absolute major points. And Jatin, have you ever experienced, Jatin and Amlan both, have you ever experienced a situation where you feel that your role as an optometrist has been undervalued?
Yeah, so when I started this place, the thing that was happening was I had to begin with training my sales staff and all of those things. So there were times when I had to go and step behind the counter, help the person out with their frame choices, and recommend the lenses there itself because I'm already there, so why not? But then that was sort of causing that effect of them looking at me as an optician. So initially that was a bit of a problem, but once I had the staff under control, everything was taught and everything, like they were well trained. I never used to step out of that clinic thing, that circle that I had. It doesn't matter what the problem was. He was there. He used to handle everything by himself. It was only when the frame was like, "Hatike, I maybe like this frame. I will go in for a checkup now." That is when they used to come and interact with me. So I was not stepping in that sales wala portion.
Right.
That is sort of that helped creating that trust, or maybe that thing that okay, he's not a normal optician,
There you
maybe
go. So
work on the side.
so the way that you're differentiating yourself is by physically removing yourself from that situation and taking on people and training them to be the front of house while you take care of the clinic at the back. Okay, great. So Amlan, what responsibilities do you think you have that you have as an optometrist, which is not which is different from an optician? What do you feel are your responsibilities, like from an ethical perspective, as somebody who's done a 4-year degree in optometry, somebody who is now a qualified healthcare professional, unlike the opticians?
Isha, can we stop for a bit? Just a minute.
Yes.
Sorry for the interruption.
Okay.
But we're just going to take a little pause here. I know the discussion is getting intense, but the session is sponsored by Asira, and so let's hear from our sponsors. Asira is an optometry AMR software created by an optometrist for the optometrist. So here it is. One second. Can you see my screen?
Yeah. Welcome to Asira, the ultimate cloud-based solution designed by eye care professionals for eye care professionals. Asira is an intuitive, easy-to-navigate hub that puts all your essential tools right at your fingertips. Here, you can manage your clinic appointments, access patient records, generate bills, and much more with just a few clicks. Asira simplifies record keeping with its comprehensive EMR system. You can easily search for a patient, review their medical history, and update their records in real time. Scheduling appointments have never been easier, helping you stay organized and on top of your schedule. Most importantly, you can select from Asira's extensive list of appointment types, each with their own customized template. As you conduct thorough eye examinations, Asira works quietly in the background, seamlessly integrating your findings into the patient's records. From visual acuity tests to eye care specific drawing tools, integrated grading scales to detailed retinal imaging, Asira ensures that every piece of critical information is accurately captured and stored, allowing you to focus on providing the best possible care. With Asira, keeping your patients informed is effortless. Automatically send appointment reminders and follow-up notifications via WhatsApp, ensuring that your patients never miss a visit. And when it comes to sharing reports, Asira lets you send them directly from the software to your patient's WhatsApp, providing them with quick and convenient access to their results, all while maintaining the highest standards of privacy and security. What sets Asira apart is its seamless flow and user-friendly interface. Whether you're a seasoned professional or new to digital practice management, Asira makes the transition smooth and stress-free. And if you ever need help, our dedicated customer support team is just a phone call away. Asira is more than just a software. It's a partner in your practice, helping you focus on what you do best, caring for your patients. Experience the future of eye care management with Asira.
That's lovely. Thank you, Isha. And for the OCI members, Asira is giving 3 months trial, a free trial. So take this opportunity and subscribe to Asira. So sorry for the interruption, Isha. Over to you again. Yeah.
Thank you very much. And I think you guys may have heard a familiar voice on that video. Take one take. So I'm going to boast that. Okay, so let's continue our discussion. So Amlan, I was asking you that what do you think are the clinical responsibilities as an optometrist compared to an optician? Amlan, you're on mute.
Okay. Am I audible, ma'am?
Yes, you are.
Actually, ma'am, as per the NCFC Act, optician does not have any kind of, clinical role. If some opticians or an opticians, it's doing refraction.
Sorry, I'm going to interrupt you. Amlan, let's focus more on the optometrist's role, what the optometrist should be doing rather than what the optician can't do. So if you could discuss a bit more on what you think the optometrist should be doing. What is their responsibility?
Yeah, so our responsibility is, it's when patients come, we should check vision and do refraction and do phonometry and do comprehensive eye examination that includes fundus examination. And so in comprehensive examination does not mean, it's only refraction. So it also includes fundus examination. So last time, 2 weeks ago, so a patient came to me. So after refraction, her vision is improved to 20/20 when I did fundus examination. So so I found out rules, and so it's 20/20 vision. It does not mean that it's vision
That the
is
patient
normal.
is
So
fine.
yeah,
Excellent. Thank you so much for that example. For those of you who couldn't hear very well, Amlan said that despite the patient's visual acuity being 20/20 or 6/6, when he did a fundus examination, he did find some drusen. Okay, so that's a great point to make, because just because it's 20/20 today doesn't mean it's going to be 20/20 tomorrow, and it means we know that we have to monitor that patient. So that's a really, really good example. Thank you for that, Amlan. And that is something an optometrist such as you guys over here would be able to detect that an optician can't. And Sudhanshu, would you say that it is your responsibility as an optometrist to detect these things?
Absolutely. As an optometrist, it's our role to do 3 things. What I believe that is diagnosis, consultation, and management. So first you have to diagnose, then you have to consult the patient that this specialty guy, like if you are sending to some glaucoma specialist,
Mhm.
so glaucoma doctors बहुत सारे हैं, but patient don't know कि that a cornea specialist cannot find out the problem in retina and vice versa. So it's our job to provide them with the best person who can solve their problem. So that comes under consultation. And after all things are done, even after that, if the patient is not able to see very clearly, then again comes our role, that is low vision. So this is how we should go with each and every patient ideally.
Excellent. I completely agree with you. I think that's a really, really great point. Now, we've been talking a lot about the clinical stuff, right? Definitely. We cannot forget the optical. Okay, we cannot ignore that completely because at the end of the day, it is our bread and butter, right?
Yes, ma'am.
Yes, we have the optical. So yes, we have to put focus on that, right? So, but my question to you, and I'm going to ask both Monil and Jatin, we'll ask it in two parts. So, Monil, do you think that the commercialization of eye care has blurred the lines between optometry and opticians? So, what are your thoughts on that, Monil? Because as we have mentioned, we talked a lot about the clinical stuff, but we cannot forget our optical business. And Jatin, you as well talked about how you have differentiated yourself. But what are your, Monil, I'll start with you. What are your opinions on that? Do you think it's blurred the line, and why do you think it's done that?
Yes, ma'am, definitely the line is it's not visible actually, not blurred, I would say, because there are many reasons, and few of the reasons would be having multiple setups like the online stores or getting more accessible to eye care is one of the reason, and other would be the competitiveness which is there.
Sorry, I'm going to interrupt you. 1 second, Monil, there's a difference between eye care and optical.
Optical,
So
yeah.
you said easy access to eye care. Is that the case? Is that what you mean? Or do you mean easy access to spectacles? They're two very different
Easy
things.
access to spectacles, I would say, not eye care. Yeah.
Right. Jatin, coming from that, what would you define as eye care?
Okay, I'm getting all of the complicated questions, I feel. So I
I
don't know.
don't mean to pick on you. Go on.
I've seen people walk in with a minus 0.75 spherical prescription, but they need something like plus 0.5.
Right.
So I don't know anymore. It's even if you're doing a proper good refraction, I think that is more than enough right now because things are not good.
But do you think it's acceptable? When you say more than enough, are you okay with that? Are you okay with optometrists? I'll pose this to all of you. You're young. You're at the beginning of your careers. I'm old. I'm well established, but you guys are young. You're at the beginning of your careers. Do you think you guys are the future? You're setting the stage for everybody moving forward. Do you think it's acceptable that, okay, at least itna to karo? Do you think that's acceptable? Or do you think that we should strive for more?
Start somewhere. Like that is something that is okay for you to start with. You can always expand. It's not possible for everyone to jump into a specialty practice from the first
I'm not
day.
talking about specialty. So we already discussed this, right? You don't have to do any specialty at all to be a good optometrist and to do comprehensive eye examinations.
Correct.
Right?
Yeah, that's what I
So,
said.
go on.
Refraction, like at least do that properly. Like उतना तो करो फिर like ठीक है like देखते हैं.
So Sudhanshu, let's talk
Yes, ma'am.
about so one of the questions is how do you navigate this challenge? Okay, so as part of that question, let's talk about this very controversial topic of consultation fees.
Yes.
Give me your thoughts on consultation fees.
So, so the current market scenario suggests that if you are going to open an optical or an optometry clinic, the eye test should be free. This is what current scenario suggests.
And do any of the four of you agree with that?
I don't.
No.
Okay.
So
I
if you
also
are
don't.
if you're going to start a new business, the first thought comes into mind is eye test तो free देना पड़ेगा. ये मैं बोलना चाहता हूँ. So अगर आप सिर्फ एक आई टेस्ट की बात करते हो जिसमें आपके आंखों के सामने एक ER रख दिया जाता है, आपकी आंखों के सामने ट्रायल फ्रेम लगाया जाता है, आपको एक स्क्रीन दिखाई जाती है, that is not even on a correct distance. As
Mhm.
I have seen in many optical stores, national optical chains, I have seen there
Yeah.
also. That is not what is expected from them. They are using top-notch AR machines, but they are not maintaining a distance. So what is the sense of putting a top-notch machine? So it doesn't matter what kind of machinery you are using, it should be accurate. But the person who is doing the refraction or who is doing the eye test, he should be paid properly so that he can provide a good eye care. सिर्फ चश्मा बनाने से आई टेस्ट फ्री कर देंगे, that will not solve the problem.
So my
Somewhere,
yeah, sorry, go on.
yeah, somewhere you have to draw a line that optometrist can provide a good eye care. Somewhere we have to start it. So even if you're taking a 200 rupees for consultation, there should be some charge so that patient realize that I'm not having a free eye test. This is something I have paid for. So they will ask you more questions and they will realize that this person is actually knowledgeable. ये
Absolutely.
वो चश्मे की दुकान में बैठने वाले वो नहीं है, नॉर्मल आदमी नहीं है. He is doing something.
So what you're saying is that as an optometrist, you guys have all done 4 years of optometry. Did you think it was easy? Like, was it a walk in the park? Was it a breeze doing optometry? There's many students on here. I'm
Bharti
wondering if the
Vidya, it is
students are
never
like,
easy.
oh, this is easy, it's chill. I can chill out. I cannot attend lectures. I cannot attend. Was it easy? Like, did you think that was easy? Or did you think that, you know what, I really worked hard to get that degree?
Yes.
So when you've worked that hard to get that degree, do you not think that your time is valuable? You know? So, and I mean, to be fair, if I get anything for free, I ordered some shoes from from this online place. I ordered some shoes, and with the shoes I ordered, they sent me a free pair of chappals, right? Now the chappals were very nice. They're really very nice, and it's something that I would pay money for. But because they were free, I'm like, yeah, I'll wear them in the house,
Exactly.
Yes.
right? So no value because it was free. I can see myself doing it. So Amlan, do you feel that it is okay to give free eye examinations, or do you feel that we should charge every time, or do you feel that we can pick and choose when we want to charge? What do you think, Amlan?
No, we should charge our consultation fee. Suppose a patient visits to me, my receptionist always tell the patient that, hello, am I audible?
Yes, yes, go on.
So we should charge our consultation fee. We should not, we should not give free consultation. So suppose a patient visits to me, my or receptionist always tell that, when I care practitioner is there, he can do your consultation and he charges 300 rupees. So we should not do that kind of, it's free test or get, buy one, get one, or do free eye examination. That is
Okay.
unethical.
Great. So absolutely. And of course, you guys have made lots of investments for your practices as well. You've invested in slit lamps. You've invested in all these equipment that will help you do comprehensive eye examinations as opposed to the opticians. So I'm going to talk a little bit about
Sorry,
yes.
I'm sorry
Sorry,
to
Jatin,
interrupt.
go on.
You see, what happens is everyone is always saying that you should charge, you should charge. No one is helping us like figure out like how should we ask them for that extra, consultation fees, because that's something I've always backed my head about. Ki, ठीक है चलो नहीं, you have to pay me 3,000. He'll be like, why? The person next door is doing it for free. Why should I pay you 3,000 for this? Is what always happens. So what I figured out a way around it. I would like to share with the
Please, that
students
would be
that I
great.
like. Yeah.
I think everyone will find that helpful.
So there are always more tricks. This is what I do with my thing. So what I do is the salesman that I have, he'll very softly speaking to the patients here. He'll be like, see what happens is you have to pay 300 rupees over there. But क्या है ना, मैं चश्मे में 300 कम कर देता हूँ. सर नहीं छोड़ेंगे, सर को देना ही पड़ेगा. मैं इधर कम कर देता हूँ. I don't mind giving the 300, 200 rupees extra discount to the patient, but the thing that goes into their mind is, I'm paying for the consultation. So next time when they walk in, they know ki, I will have to pay 300 over there. Maybe they won't ask for the same discount the next time. But it's not about the discount that I'm giving, it's about the money that I'm charging for the time. I'm okay
Exactly.
with,
So you're making the patient aware that your time is valuable. That's the key thing. You're making your patient aware that I am spending these 20 minutes with you, thoroughly checking your eyes, giving you a good eye examination, and doing exactly as Sudhanshu said, your diagnosis, your consultation, and your management. Okay. So you're doing all of that. And the end goal is to provide not just spectacles, but to provide eye care. Right? So I think that's what we're talking about. So what I want to do, and I think that's a really, really nice way of doing it, Jatin, because not only does that help you get a sale in spectacles because they feel like you're doing them a favor, but also it plants that seed in their mind that, oh, I do have to pay, like this is worth something. That means he's going to do something. What's he going to do? And then, of course, once you've got that patient in your chair, that's it. You're sorted. All you need to do is get the patient in the chair. And then the whole attitude towards you changes. So I completely agree with that. Fantastic. Okay, let's talk a little bit about the future of optometry. So first of all, how do you see with advancements in technology, okay, how do you see optometrists evolving? Monil, we haven't heard from you in a while.
Mike.
Yeah. So future is going to be exciting, I guess, because there are more and more educated people coming into this field and starting in private practice, which I can notice like us. And I guess there is one more small branch doing as teleoptometry, which is doing distance diagnosis. So which I feel is going to take place in future, while even independent practitioners like us can remotely diagnose patients via
Absolutely.
Zoom meeting, just like us.
Yeah.
So that is, I feel it's going to be future.
Okay. And what about things like equipment and software and, you know, like, for example, things like OCTs. So now, so as you all know, I used to work in the UK before I came here. So now if you go to the UK, OCT and retinal cameras have become a norm in all optometry practices. Do you see our future heading in that direction? Or do you think it has the potential to?
Yes, ma'am. Obviously, like the getting more and more instruments can create a more awareness, first of all, and we can do a proper management to that patient.
Yeah.
So I definitely agree with this point that more and more instruments and OCT and fundus camera, as you said,
Yeah.
going to be mandatory.
Absolutely. That's
Hopefully,
great.
yeah.
And Jatin, you had a comment?
I just had to add a few things to the teleoptometry thing that Monil said. So I don't know, like this is what I believe in. One of those companies, maybe Zeiss has launched a thing which is as big as an AR probably, and it will do the full, like you'll get a proper refraction done. You'll just get the power at the end of it. You just have to click one button and it's done. So things like these are going to be helpful, but I don't think they're much needed in a place like India because there it's more relevant because there are not a lot of people who are into this field who practice a lot. So there's a shortage of practitioners, a lot of patients. Sometimes people have to wait maybe 2-3 months for an appointment.
Right.
So they will benefit from this. But here I think it's always cheaper to get someone to do it instead of buying the full equipment and then using it. So
India is not for
it's
beginners.
going to be very
And it's not for
slow
beginners.
if it is going to come to India. I think it's going to be very slow.
Yeah.
And things like same like OCT and fundus photo being a norm in every optometry clinic. I don't know, little controversial. I feel like it's not that required because again there are a lot of people. It's very easy for people to access all of those equipment.
So you're saying rather than making the investment yourself, you would rather partner with someone who has the machine and send them there for the
Correct. Because here you
That
have to
makes
wait
a lot of
2-3
sense.
months
That
for an
does.
appointment. So
That
it's
does make a lot of sense. In
not that
fact, I don't know how it is in your cities, but in Bombay, we actually have an organization that brings the machines to us.
Yes.
So for example, I don't have an OCT, but I do a lot of glaucoma screening, and I just have to call them one day before and say, bring the OCT on this day at this time, and they'll bring it. And it's really, really quite useful. So, okay, interesting. Thank you. Amlan, did you have a comment?
Yeah, so optometry is now regulated in India. Am I audible now?
Yes.
Yeah, optometry is now regulated in India. One NCSP Act implemented across the Indian states. So You don't need to worry who is going to do refraction in optical outlet or not, because it's there is certain act is there. So section is there. So you don't need to worry for that. Like so I would like to mention, like as per section 32 and section 57 of the NCPC Act, no one other than optometrist, can do reflection and do eye examination, uh, except ophthalmologists independently.
Of course. But so essentially, an optometrist like ourselves, we are what's known as primary eye care practitioners, correct? And Sudhanshu, what do you think is the role of a primary eye care practitioner? What do you think is the role ultimately?
So the ultimate goal is to provide the मतलब primary eye care, में primary diagnosis, the early detection of major diseases.
Exactly.
So this is what should be done.
Exactly. Right. Absolutely. I mean, yes, we all know how to refract, right? Of course. That's the most basic thing. But as primary eye care practitioners, as Amlan said, with our regulation, we have the responsibility to not just give them a good, accurate prescription for their spectacles, but also to offer to do a good screening for eye disease. So excellent, fantastic. Okay, so just a couple of things What advice, Monil, I'll ask you, what advice would you give to aspiring optometrists to avoid being perceived as a glorified optician?
One of the first advice I would like to give is to have a proper education. Even after a bachelor's degrees, you either pursue master or fellowship or anything, just get more and more degree added in your feather. And then when you are into the battle of private practice, when you come prepared. You know how is the market, you know what type of patient you're going to deal with, and following that, you practice accordingly.
Jatin, do you agree with Monil that it is absolutely required for you to have a master's, or do you think that you could also pick up this kind of clinical work by working with the right people?
I was going to bring this exact point up right now because I don't know, not everyone will be comfortable with spending that much amount of time. I mean, one of the reasons I skipped ophthalmology was because I was going to spend 15 years learning.
Exactly. And
I just want to get out, get something done.
absolutely.
So you can, the first point is don't jump into a private practice is what I will feel. Get your degree done, work with someone, get
Yes.
an idea of what you want to do. Maybe you'll be happy working as a proper clinical person in a hospital or some place like that. Maybe you want to do something by yourself, like, okay, I'm okay with not doing this clinical thing every single day. Once a month is good for me, but I want to do something of my own. So you can start something like that. But uh, I don't know, thinking that you'll see maybe 2 3 specialty patients a month is an outreach.
Yeah.
At least for the beginning, once a month, you should be happy with that. Even so, that is little difficult in some on some days. So
Actually, but see, speciality, like I said, we keep coming back to speciality. But if we look at when I'm talking about entry-level optometrists, right? Speciality is, if you look at optometrists in the UK, in the US, in Australia, even there's just a handful. In fact, I think there is more optometrists in India doing specialty optometry. And I think this is where the problem lies, that we only define ourselves as optometrists if we are doing specialty, which I don't think is the case. I disagree with that. I think if you're a good optometrist doing good comprehensive eye examinations, the patients will flock to you and they will only buy their spectacles from you and no one else because they trust you. What do you think, Sudhanshu?
Actually, you are right, but I wanted to add something, and I have a question for you as well.
For me?
Yeah. So
Wow.
my question is, like, you are practicing optometry in India since so many years now. So what do you think that is diploma enough to be a optometrist in India? Because many students come to me, like my father's junior, मेरे पापा के जितने भी junior है from his batch, अब उनके बच्चे they are now ready to do optometry. So the one single question they ask me, and it hurts me every time. Like government is recognizing diploma holders, the ophthalmic assistants, to be like for the government jobs, not an optometrist. I have seen a paper like where it was clearly written only ophthalmic assistant, not optometrist. So this kind of things are happening in India, and we are talking about the entry level optometrist. So this is a very confusing thing for a student who don't have an optical background. Like we three, we four all have the optometry background and optical background, so we are confident that we are talking on a such platform right now.
Correct.
But those people don't. So they just want to do a job, and they are not getting it by doing bachelor in optometry. So what are your views on this?
So first of all, optometry is to be, and now since 2021 to call, and Amlan, I know this is what you're going to say. Since 2021, to be called an optometrist in India, you have to have a 4-year bachelor degree as per the NCAHP guidelines. And only optometrists with a 4-year bachelor degree can practice unsupervised. As of 2021, we can practice, we have now become independent healthcare practitioners, like physiotherapists. We are no longer allied health. Your diploma holder can still practice, but they fall under your allied health. So they cannot practice without the supervision of either an optometrist or an ophthalmologist or a doctor. Like even a general doctor is fine, right? So no. The answer to your question is no. You cannot be an optometrist with a diploma holder, and you cannot call yourself an optometrist with a diploma. So if you're a diploma holder, you can practice, you can go into the hospitals, and you can be, now I'll say, a glorified button presser, right? You can be a glorified photo taker, right? Yeah. So no, I don't think, and I think this is where this question of our identity as optometrists is very important. Our identity is something that we need to really keep discussing, and you young people need to really keep discussing and set an example for the rest of the country and for young aspiring optometrists such as yourself. Okay, so now I'm just going to end here before we move on to comments from you guys and comments from the audience. In one sentence, all of you, one sentence. I'm going to start with you, Sudhanshu. How would you summarize the distinction between an optometrist, an optician, and an optician, and why does it matter? One sentence.
So one sentence is what is written on my visiting card. That is, do primary diagnosis, consultation, and management. I think that is enough to get differentiated from an optician.
Excellent.
Let it be optician, let it be a glorified optician. It doesn't matter. If you're doing these three things, you can make a difference. It is that simple.
Okay. What about Amlan? One sentence. Distinction between an optometrist and an optician.
Yeah, am I audible, ma'am?
Yes.
Yeah, so optician is, it's optician is the person who gives or who helps to read eyeglasses or he sells eyeglasses, and optometrist is the one who is the primary eye care practitioner, and that who is prescribed who prescribe eyeglasses, contact lenses, and do primary eye examination.
Absolutely. Wonderful. That's a great description. I agree with you completely. What about you, Jatin? One sentence.
So I don't know if it is a little much what I'm going to say, but optician, I don't know, like they're qualified enough to sell you frames. That's all. Lens recommendation, what type of lens you should be wearing also is something that I don't know if they're qualified enough to make that decision or to help you make that decision. So
do you think a diploma holder would be qualified enough to do that though?
I don't really know, because I don't think they've been taught enough about dispensing as well. So
okay. So you think that there is that when it comes to dispensing, really, even when it comes to dispensing, it really is the optometrists that have been trained well. Having said that, I do think that dispensing is something you can really learn with experience as well. You know, so those of you whose fathers, both of you said your fathers are in have been in the optical field before, and they're not optometrists, right? But however, they would probably do a better job recommending or dispensing spectacles than the two of you would because of the years of experience. So I think that dispensing is something that can come better with experience, and with some good training as well. But I agree with you that the job of prescribing and the job of the primary eye care should be the optometrist. Finally, what Monil, one sentence.
Ma'am, I would say optometrists are the, primary gate for the patient who
Mm-hmm.
will guide them where to go further. Like,
Right.
as we compare with the other countries, either it's in a normal checkup, we can completely do it, accurately. But if
Yes.
it required any further assessment, the optometrist, the one who can diagnose, can refer that patient to the, respected person. So they provide a very smooth medium between where to go further. Either they need to stop and they are okay with the eye health, well and good, or else they need to be, referred for another place. So that's what an optometrist can do.
Absolutely. Thank you very much. So, the four of you, I would really, really like to thank you so much for your insights. And I'm very proud that we have such young, enterprising optometrists who are practicing real optometry in India. So that makes me very happy and very proud. So I'm grateful to you guys for representing our profession as well. And I hope that everybody who attended this talk can use you guys as an example and see how you could be and where you could be if you really applied your mind to being a good optometrist, not just a glorified optician. So thank you very much. So I will hand this talk back over to Harshada. Harshada, in case we have any questions for the panelists from the
Yes.
audience.
Yeah. Before going to the questions, I would like to take one poll for the audience. 1 second. Yeah. Can you see that?
Very controversial question, Harshada.
Summarizing the talk.
Yeah. Okay, just give a few seconds. Those who are on Facebook, you guys also can answer by just clicking A for optometrist and B for glorified optician. We've got good comments on the Facebook, Isha. A lot of comments.
Okay, we're
Yeah.
happy to listen to the comments as
Yes.
well. So whatever, I'll leave that up to you, whatever you think you want to present to the panel. Please go
Yes.
ahead.
Okay, that's wonderful. Almost 100% of the audience thinks they're an optometrist. Great.
Good.
Okay, I'll just end the poll. Yeah. Okay, people on the Facebook also, they have replied option A. That's great. Okay, so we've got good comments, mind-blowing questions, Isha. Very, very core important questions related to the optometry practice that needs to be extremely clear in the minds of the young optometrist. Yes, then we have yeah, either you press buttons or you are doing specialty. Optometrist is so much in between. So quite a good comments on the Facebook. We have few questions here on the chat box. I think he's a student, Nizamuddin SK. So he's an optometry student, and his question is, can he prescribe medicine for the eye after his graduation? Is it legal or illegal in Assam, India? So,
I think we'll let Amlan take that one.
yeah.
Amlan,
Okay,
yes.
yeah, am I audible?
Yes, you're audible. Go ahead.
Yeah, so actually,
I can't hear you, Amlan. Somebody's on, Harshada, can you
Yeah,
mute the,
yeah, I did it. Yes. Okay.
Amlan, go ahead.
actually, actually, our practice, our scope of practice. Yeah, am I audible, ma'am?
Yes, yes.
Yes.
Yeah, our practice, our scope of practice of optometry is not yet defined by the National Commission for Allied and Healthcare uh, Commission. So we should wait for that. So our, it's scope of practice is not prescribed. So we should have to wait until and unless the National Commission for Allied and Healthcare, it's uh, comment on that.
So hopefully, Nizam, by the time you graduate, we will have a bit more clarity on that. And it also is different from state to state. Yeah, Jatin.
So I don't know, like there are a lot of cases where you'll have to work together with ophthalms. Like suppose you're looking at a fundus,
Absolutely.
there's a drusen, maybe DR signs are there, you have to refer them to an ophthalm. It's all like I was doing my internship with Sauji sir, so he has always drilled this one thing in our mind. If someone is not referring patients to you, you refer twice the patients to them.
Absolutely.
शर्म खा के भेजेगा ही वो फिर पेशेंट एक आधा. So legality अभी तक, because it's in a gray area, it's always better कि refer कर दो. You'll get the patient back, नहीं तो भी they will in future maybe refer you a good patient. कुछ तो like suppose progressive dispense किया था, there's some troubleshooting required, they're not adapting to the glasses, they'll send them to you. कुछ तो काम आएगा ही. So it's always better to refer instead of playing in that gray area is what
Yeah, and to protect yourself as well. It is always better. And I'll speaking from experience, I do work with a lot of ophthalmologists. And speaking from experience, once the ophthalmologist recognizes you as a good optometrist, once they realize that, oh, this person knows what they're doing, like this person knows what they're talking about, they will have that respect for you and they will send the patient back to you. Or they will at least give you a report. This is what I found. These are my findings, etc., etc.
Exactly.
Then you can follow up with the patient. And if you do a good job, the patient will come back to you because they also trust you because you found the problem in the first place. So from the patient's perspective, you found the problem and you sent them to the appropriate specialist. And then they will come back to you. If you did a shoddy job and you didn't give them the time or attention they required and you send them somewhere else, they're not going to come back to you if the other person did a better job than you. So it's best for you to do the best, give them the best possible care and ensure that way they will come back to you. Thanks, Jatin. Okay, Harshada, next question.
Hold on one second. Okay, another question is why optometrist they can't add doctor prefix in front of the name in India.
Because
yeah.
we've not been given that privilege yet. That's it. And also we're technically not doctors, right? We don't have an MBBS. So physiotherapists and dentists have rallied. Okay, they have lobbied and rallied with the government. And I believe that, there are several associations of optometrists within India who are also rallying and lobbying with the government. But do you need it? Do you need to be called doctor? Like, is it necessary? If you wanted to be called a doctor, why didn't you do medicine? Right? So you don't have to be called doctor to be a good practitioner, to be a good healthcare practitioner. So I don't think the doctor thing is necessary. You can always do a PhD if you want doctor in front of your name.
Very true. Okay, Zenith Fatima, do you have any questions? You've raised your hand. If you have any questions, you can unmute and talk, no problem. Zenith?
Ma'am, basically, what are the complications one can face in the condition of a severe dry eye?
In the sorry, what was the question? In the
What are the complications one can face in the condition of a severe dry eye?
severe dry eye, I think you should read up on that a little bit.
Okay, ma'am.
Because we're not talking about clinical questions over here. So when you're talking about severe dry eye, you're talking about how should we be managing it as optometrists, like what are the steps we should be taking, or are you asking me what are the signs and symptoms of severe dry eye?
Basically, ma'am, what are the signs and symptoms?
Right, that's something I think that the best thing would be to sort of go back and read up on that a little bit, because that information is quite readily available everywhere, actually. But if your patient does have severe dry eye, then as an optometrist, you actually are within the scope of your practice to treat that and manage that.
Okay, thank you, ma'am.
Sure.
Okay, I think Isha, it's past 5 o'clock. We
Oh, is
should,
it?
yeah.
We were having
Yeah.
having a lot of fun, I think. So we've lost track of time.
Amazing discussion, and I must say, all of them are so young, but still had so many insights to share. So I know it was a very sensitive topic, but you guys gave a full justice to the topic. So thank you so much. I have shared best practice standards document and the optometrist code of ethics and conduct links in the chat box. So those who are not aware, you can go ahead and read those documents. So thank you, Sudhanshu, thank you, Monil, Amlan, and thank you, Jatin, for participating in the panel discussion. And of course, thank you, Isha, for making it possible. Lovely questions. It was not possible without you. So thank you all the participants for attending this session.
And sorry, Harshita, just one more thing. If anybody is interested in a demo or a free trial of Asira, please get in touch with the OCI team, or you can get in touch directly with me via the OCI team.
That's right. I was about to say that. Okay,
Not a
thank you
paid
all.
promotion, but I am using Asira. It has helped elevate my practice, of course, because that thing you need to differentiate from the optical. It really helps with that. So you can actually consider doing that.
Oh, that's great, Jatin. Thank you so much for sharing your experience. Thank you all. Thank you all the participants for attending this session. If you have any queries or anything regarding you want to ask Asira, so you can contact us on info@ocindia.org. Okay. Thank you all. Have a lovely evening ahead.
Thank you very
Thank
much.
you.
Thank you, panelists. This was a wonderful discussion. See you
Thank you.
guys.
Thank you, ma'am.